Therapeutic drug monitoring. Monitoring drug therapy by measuring plasma concentration of a drug is known as therapeutic drug monitoring. How do we do therapeutic drug monitoring? By measuring the plasma concentration of a drug. Monitoring drug therapy by measuring the plasma concentration of a drug is known as therapeutic drug monitoring or TDM. Indications of TDM: drug with narrow therapeutic index like lithium, digoxin, phenytoin, and aminoglycosides. Lithium, digoxin, phenytoin, aminoglycosides, these are drugs with narrow therapeutic index and they require therapeutic drug monitoring. Drugs showing wide inter-individual variations, like tricyclic antidepressants. Tricyclic antidepressants require therapeutic drug monitoring because they show wide inter-individual variation. Tricyclic antidepressants show wide inter-individual variations. Third, to ascertain patient's compliance. For drugs whose toxicity is increased in the presence of renal failure, example aminoglycosides. So therapeutic drug monitoring is done for aminoglycosides two reasons, because it has narrow therapeutic index and its toxicity is increased in presence of renal failure. Aminoglycoside has a narrow therapeutic index and its toxicity is increased in presence of renal failure. In patients who do not respond to therapy without any unknown reason, therapeutic drug monitoring is done in patients who do not respond to therapy without any known reason. In drug poisoning, estimation of plasma drug concentration is done. So, therapeutic drug monitoring is monitoring the drug therapy by monitoring the plasma concentration of a drug. Indications of therapeutic drug monitoring: drugs with narrow therapeutic index like lithium, phenytoin, digoxin, and aminoglycosides. Lithium, phenytoin, digoxin, and aminoglycosides have narrow therapeutic index. Drugs with wide inter-individual variations, example tricyclic antidepressants. Tricyclic antidepressants also require therapeutic drug monitoring because they have wide inter-individual variations. Therapeutic drug monitoring is done to ascertain patient compliance. It is done for drugs whose toxicity is increased in presence of renal failure, example aminoglycosides. It is done in patients who do not respond to therapy without any known reason. In drug poisoning, estimation of plasma concentration is done. So for drugs like lithium, digoxin, phenytoin, aminoglycosides, and tricyclic antidepressants, these are certain drugs that require TDM: lithium, phenytoin, digoxin, aminoglycosides, and tricyclic antidepressants. Therapeutic drug monitoring is not required in the following cases: when clinical and biochemical parameters are available to assess response. When clinical and biochemical parameters are available to assess response, then we don't need to measure the plasma concentration, like blood pressure measurement for antihypertensives, blood sugar estimation for anti-diabetic agents, prothrombin time, APTT time, and international normalized ratio for anticoagulants. So, in case of antihypertensive, anti-diabetics, and anticoagulants, we do not require TDM because we have certain clinical and biochemical parameters to assess the response of these drugs. So we don't need to measure the plasma concentration of these drugs. Like in case of hypertensives, we can measure the response of the drug by measuring the blood pressure. For anti-diabetic, measure the blood sugar level. And for anticoagulants, we have prothrombin time, APTT time, and INR, that is international normalized ratio. It is not done for drugs producing tolerance, example opioids. So opioids do not require therapeutic drug monitoring. Opioids do not require therapeutic drug monitoring because they produce tolerance. It is not required for drug whose effect persist longer than that the drug itself, like omeprazole. Okay, not done for drugs whose effect persists longer than the drug itself. Example, omeprazole. So TDM is not done for antihypertensive, antidiabetics, and anticoagulants because we have certain clinical and biochemical parameters to assess their response. TDM is not done for opioids because it produces tolerance. TDM is not done for omeprazole because the effect of omeprazole persists longer than the drug itself. So TDM is done for lithium digoxin phenytoin aminoglycosides and tricyclic antidepressants.